The last chapter that we are going to cover this semester is Chapter 11, and this is diseases that are caused by protozoids and metazoids. Cryptosporidiosis is among one of the most common causes of diarrhea in patients with AIDS and other impairments of the immune system. In 1978, there was a outbreak at a water park where there were 358 cases reported, and this is transmitted through the fecal-oral, person-to-person, and foodborne route. It can be asymptomatic or profuse and watery diarrhea. Children, when they get sick, they may have vomiting before the diarrhea starts. And in this particular case in the water park, you can read about it in our textbook. It really kind of made kind of an overview of how water parks and swimming pools should and are cleaned after someone has an accident of a bowel movement or vomiting in the pool. And in this particular case, they looked into what they did, and I believe they cleaned the mess, they added additional chlorine, and then within about a half hour they would reopen the pool. But after this happened, they actually had to rethink how to clean these type of systems after vomiting or diarrhea vomiting or stool in the pool. The next disease that we're going to look at is Giardias, and it's found more common in children in the United States. It is also common in travelers from endemic areas, campers that are drinking impure water from streams or lakes, and it is the injection of these little cysts from the Giardia protozoid that are acquired through fecal-oral route and person-to-person. And actually the individual gets really sick, abdominal cramps, pale, loose, greasy stools, nausea, weight loss, dehydration. And although they say that you don't really see it much in the United States, you do see it. Another way that people can acquire it is through wells. So that's why it's very important if you are acquiring your water through a well that it be checked on a regular basis for any bacterias or any infection that may be growing inside of the well, and so that it can be treated. Common in travelers, a lot of people that come from South America, a lot of people that go to Mexico will come home with Giardias. And like I said, people get really, really quite sick with it, and it's non-stop, usually cramping and diarrhea. The next disease that we're going to look at, and you'll notice I'm not going into a ton of information on each of these conditions. They're pretty basic the way they're written up in our textbook. We can look into it more, and I could provide you with more information, but I think really just the overall discussing the infection itself and transmission prevention, so on, is what's important here. Ambic dysentery it can be acute or it can be chronic, and it's a parasitic protozoid. And about 1 to 3% of what we see in the United States are in mental institutions, and most runs much more proliferate in male homosexuals. The individual that carries the cyst can spread that. It's communicable as long as the individual is infected with the cysts. And once again, this comes down to the ingestion of feces, contaminated food and water, and oral anal sex. The individual, this is another disease where the individual gets really sick from it: sudden high fevers, chills, extreme stomach cramps, bloody diarrhea, and it doesn't just go away. It can last up to 4 years, anywhere from 1 to 4 years. And the prevention of it is, once again, I talk about our public health system in the United States, but it's sanitary disposal of feces, hand washing after defecation, washing fruits and vegetables. Contaminated water should be boiled, and anybody who is infected with dysentery should not be preparing food for other people. And talking about contaminated water should be boiled, what they're saying is if you're out camping and you want to obtain water from what you think is a spring, that water should still be boiled to a particular temperature to kill the dysentery, to prevent the acquiring of it. And I'm sure many of you, if you have children, or if you're female and you've been pregnant, one of the things that they talk about is toxoplasmosis. And it's really not dangerous for the average person, but it's very dangerous for a pregnant woman. It's dangerous for the unborn child. So if the mother would acquire toxoplasmosis, generally speaking, the baby, if it's within the first or third month, the baby would be stillborn usually. And another thing is that it can be severely deformed. It is a protozoid that is the Toxoplasmosis gondii. Host to human comes again in cysts which live outside the host, and its common ingestion is undercooked lamb or pork. It also is common in the feces of cats and other animals. And as I said earlier, if the pregnant mother would happen to obtain toxoplasmosis during the first trimester, it usually results in a stillborn birth. And prevention is, and as we finish out this chapter, all meats should be cooked thoroughly. If cats are kept inside and fed commercial prepared food, they should not become infected, so there's really not a need. But if the kitties are outside cats and they're hunters and they happen to hunt, a bird or a mouse or something that has the cysts of toxoplasmosis, then it goes through their system and they use the litter box. If the female is cleaning that litter box, she can inhale the dust from the litter, which could have the cysts in it, and that would be how the female would acquire toxoplasmosis. So one of the warnings is that pregnant women should not clean kitty litter boxes. And the other thing on a large scale public health basis is public sandboxes. And also probably I would say if you had a sandbox in the backyard for your children, they should be protected from stray cats using it as their litter box. Because then we've got children playing in it, and the children can become contaminated. Next are pinworms, and they are the most prevalent infection with worms in the United States. You'll see this more common. It's mostly in children, and it is transmitted directly from the anal area to the mouth. And these little worms, they live in the intestines of humans. And you can obtain them, obviously, like I said, from the anal area to the mouth, which would be, not wiping yourself or cleaning yourself after you have a bowel movement, or the child not wiping or cleaning themselves properly, and touching that area and then putting their fingers in their mouths. Or also the fact that the child possibly would wipe himself and not wash his hands afterwards. And if he had pinworms, that would be another way to acquire them. Anybody that has been in contact with the child needs to be treated. The anything like the articles such as sheets, clothing, any foods, any items that the child would play with would be susceptible to having the pinworms, and then the next person obviously acquiring the worm itself. Humans are the reservoir for the infection. There is no evidence of an animal being a reservoir, and the life cycle is about 2 to 6 weeks for the pinworms. And what happens is at night, when it's dark, the worms will migrate to the perianal area, which is the anal area, and they lay their eggs. And it almost looks like rice, and you'd really have to do an inspection to actually see it, but it's intensely itchy for the person that's infected. And they'll claim of it tickling, and that's because the worms are moving around down there. And usually how they diagnose is that the physician will place a piece of like cellophane tape by the child's anus, take the tape and look at it under a microscope for diagnosis. And pinworms, like I said earlier, the entire family needs to be treated if someone in the family has pinworms. And the best prevention, once again, is going to be education. Cleaning yourself, washing your hands, making sure that the child is washing his hands as well. And so this is just a picture of the pinworms around the anus as they come out, like I said, closer to when it's dark. They come out and they start to shed and lay their larvae. So, like I said, it kind of almost looks like white rice. Next is roundworms, and in the United States, about 4 million people are infected with roundworms. The individuals, they're acquired by humans through ingestion of soil that's contaminated with human feces that harbor the eggs for the worm. You can acquire this by eating raw vegetables and fruits that are contaminated by not properly washing them. After the eggs are eaten, they hatch and they'll release larvae that penetrates the intestinal wall and will reach the lungs through the bloodstream. Up to 90% of population in poor countries are infected with roundworm. However, we don't see a ton of it. I should take that back. It's very localized when you see roundworm. It's not generally everywhere. It's more in a localized area. The worm competes for food with the host, and in children it can retard their growth due to malnutrition or being malnourished. Often the first symptom, as gross as this sounds, may be a live worm noticed in the individual's stools. They might have a little bit of belly discomfort, but that's not usually until the worm progresses. And if somebody in the family has roundworms, once again, all the members need to be treated. And this is just a picture of the roundworms and kind of what they look like. I'm not quite sure if this was intestinal or if this might have been in the belly, but here's what they kind of look like. Here you can see the worm actually, because like I said, it hits the circulatory system. You can actually see this worm in the individual's eye. And in this picture you can see the worm right across the top of this individual's foot. Trichinosis occurs when meat containing the cyst is ingested, usually seen in pork, and it is seen in eating raw or insufficiently cooked meat, but it's particularly seen in pork. If only a few worms are ingested, the individual would just have mild symptoms. If a heavy amount were ingested, it's vomiting and diarrhea. In severe cases, it can lead to death. It's almost like a really bad case of food poisoning. But remember, trichinosis is directly associated with pork. And not to gross you out, but this is a piece of meat, and you can see all the white areas. Those are all worms of the trichinosis that are embedded within the meat. Next is hookworm, and this is a particularly odd type of worm. It likes to live in like a nice sandy soil with a high humidity, a warm, not a worm, but a warm climate, and failure to wear shoes that provide conditions for acquiring hookworm. And even though it sounds kind of almost like it can't be true, but literally the worm burrows in the sole of your foot. And the incubation is anywhere from a few days to several months. And it can also be from not a few days, but it can initially start a few weeks to a couple months later. Infected individuals can contaminate the soil for years. And I don't know if you remember me telling you the story about when I got my one corgi from the breeder, and she had had heartworm and hookworm, and that hookworm was what the vet was so upset about, because he said it's a terrible public health problem because it doesn't die, it contaminates the soil. And so guaranteed all the animals that this woman had on her farm were contaminated with hookworm, because when the animal comes in contact with it, it burrows into their skin and they have it. And the hookworm is a pretty nasty looking guy too. The larvae penetrates through the skin into the foot, it passes through the circulatory system into the lungs, enters the alveoli, then migrates up the windpipe, and then they are swallowed, and then they enter the GI tract. And that's, you think about that, that's a pretty long haul for that worm, but that's how they enter the GI tract. And here in the GI tract, then they mature, they mate, and they deposit eggs, which are excreted in the feces, which starts the cycle all over again. And the symptoms really are a red, intensely itchy ash that develops at the point of entry, which is usually on the foot. The patient can have a cough, a non-productive cough, could turn into pneumonia, and they will have some abdominal discomfort as well. The most serious result is the loss of blood, which can lead to anemia, an enlarged heart from increased oxygen demand, and eventually heart failure. And so here's a picture of a hookworm, and you could see these little upside down triangles. Looks like teeth, actually. That's what they call the hooks, and it literally uses those to crawl and hooks into wherever it is, wherever it's moving to. Tapeworm, there are various species of tapeworm, sometimes present in beef, fish, and pork. This is where eating undercooked food, once again, is just not a good idea, especially with fish. And that's been the biggest issue with sushi, that if the fish happens to be contaminated with tapeworm, then the individual eating that sushi is going to get tapeworm. And these things can grow 20 to 30 feet long and lodge themselves in the intestine. I mean, the thought of that is horrific to me. Worldwide, it's everywhere. It's not just seen in one area. It's not just seen in a poor country or so on. It's more prominent where beef and pork are eaten raw, and where sanitary conditions allow pigs and cattle to have access to human feces. So you eliminate that first human there. So if pigs or cattle happen to eat the feces that happen to have the larvae, then of course they're going to get the tapeworm as well. You don't see it a lot in the United States because we are so specific on what temperature the food needs to be cooked at. In fact, several years ago, it became a law where the restaurants have to put eating undercooked food can cause this, and this. We don't see it in the United States, but we do see it in immigrants that have carried it into the country. So that's still something to be aware of when, that's why patient history is so important in diagnosis. But like I said, if you want to go ahead and you want to do a Google search on tapeworm, and I didn't want to freak anybody out by putting any pictures of sushi, because I know everyone loves sushi, but it is pretty prominent in raw fish. So the tapeworm that we find in pork is communicable from person to person, but the other tapeworms are not. From the time of ingestion, it takes 8 to 14 weeks for the eggs to appear in the stool. The eggs remain infective in the environment for months. And so here is just a picture of a tapeworm that was retrieved. Like I said, you can go online and you can look a little more in detail if you want to, but it's not a pretty sight. And the last disease that we're going to talk about is scabies. And scabies, a lot of times you'll see if one kid in school gets scabies, then pretty much everyone's going to get scabies. It's kind of like lice, which is actually the last disease that's talked about in the book. I didn't discuss it in the PowerPoints. You can read over it. I think people are pretty familiar with lice. But the scabies are little mites, and they burrow under the skin, right underneath the subcutaneous area, and the contact is from skin to skin. So that's why you can see if you have scabies in school, it runs rampant in nursing homes. If any of you work in nursing homes, I'm sure you already know that. Then everybody that's working in the nursing home is at risk for scabies as well. The itching is increased at night, and you get little papules and vesicles. And you also can see little tiny burrow lines, like almost scratches on the skin where that little mite is underneath the tissue burrowing. So that's a pretty big indicator of scabies. Incubation is from 2 to 6 weeks in persons that are newly infected. You usually will see it between the fingers on the anterior surface of the wrist and elbows. Individuals get them in their armpits, along their waistline, the nipples of females, and the genitalia of males. Scabies can also be considered sexually transmitted because it can be transmitted from female to male and vice versa during sexual contact. And this is just a picture of the scabies on an individual. You can see on their hand and how it's moving up the inside of the wrist. And you can kind of, if you really look, you can kind of see just the little paths that they've taken, the little lines that they've taken. So once again, highly communicable disease. So that about does it then. That's where we're going to end up the semester as far as our chapters that we're covering. And if you have any questions or concerns about anything that we've gone over, feel free to let me know. I hope you found this pretty interesting and broadened your knowledge quite a bit on the different infections that, communicable diseases and infectious diseases that are out there.